Back to politics. Want to bring in Congressman Andy Biggs, Republican from Arizona and a member of the House Freedom Caucus. Sir, I want to start with you on health care reform. Is something at this point better than nothing? Are we getting down to that rationalization and perhaps realization?
Well, I mean, something has to happen. I mean, we can't just not get this done. I mean, this is a promise we made, but the Obamacare is just failing so badly, and it's going to continue to be a massive drag on the economy and on people's ability to get health care. So something has to be done.
Again, we know that. That's how you guys were propelled into power. You've gotten the states, you've gotten local elections, and of course you've got House, Senate, and the White House. So that part of the narrative everyone gets. But there is some growing frustration that you had 7 years of complaining, and now there doesn't seem to be a cohesive plan.
Well, you know, I think that there was a plan, and we passed literally dozens of bills over the last 6-7 years, which would have been a great plan. But once things got going, we had a president who would actually sign one of those plans, then some of the people who previously had voted for those plans, those repeals, those replacement type plans, they kind of said, well, they kind of got cold feet. So I think the pressure needs to stay on, which is why I asked that we stay in Congress through August. We have to keep working. This is the big timber. We've cleared the underbrush. We need to get the big timber going, start cutting that down.
You know, let's talk about the tensions on both sides of this big timber. On one side, you have the House Freedom Caucus and conservatives who believe in smaller government, who have advocated for this. On the other side, you've got these states that have accepted Medicaid expansion, and they have their own individual things that they want. So you've got some core positions, 4 or 5 folks on both sides of that divide, and you wonder which side is willing to give up or give up the most.
Well, you know, that's why we have to take some time. I mean, we shouldn't be fleeing this. We should be getting together. We shouldn't be negotiating publicly. We should be getting together and hammering this out. And I think that's what's going to happen. I mean, we've got a lot of work to do. The Senate still has to get this done, and I like what President Trump tweeted out last week. He said, look, hey, you know, that's, by the way, this is his favorite way to communicate. But he said, look, let's go ahead and just do a repeal. I think we could do a delayed repeal, and then we could work on the reforms and get those in. And he tweeted that out. You know, that was jumped on by a couple of senators. That's not a bad plan, but will that get 51? I don't know.
Yeah, no one knows, although it felt like the conventional wisdom was that was dead on arrival, but certainly Ben Sasse, Rand Paul, you know, they voiced some, and this is, by the way, what the American public wanted. And maybe the problem was when the Republicans started saying repeal and then they added and replace. They dug themselves in this hole that they've got to happen at the same time. The messaging part of this is another area where it feels like the Republicans have really been weak on, not articulating to the American public that, hey, we're not going to take anything away from you. We're going to make it better for you. Is there some central person or entity working on that?
Well, I think leadership's trying to get that message out, but you're right, the narrative's been controlled by the other side, and they've been very effective. Well, I'm waiting here today. I saw 4 ads or so that just say, hey, don't do anything with Obamacare. And yet when I go out and talk to groups and individuals, they get it. Obamacare's got to go. They get it. They want the repeal. They get it that we can reform this thing over time. But what they want is predictability, certainty. They want access to health care, and they're not getting it now. And they all get that. But we're doing it. You know, we're not getting our message out there as effectively as I'd like. Right. But I know people are out there pitching. We're pitching, but we're not getting the hits that we need to.
Real quick, before I let you go, I want to ask you about the bills on sanctuary cities and Steinle, the Cates law. Again, conventional wisdom saying that this is dead on arrival in the Senate, and it's a head-scratcher. So who the hell would be opposed to this?
Neither of these should anybody be opposed to. There's nothing racial about either of these 2 bills. It's common sense. Even some of my liberal columnists here in Arizona have written that this is common sense legislation. I don't know why anybody would obstruct this, and so I still remain hopeful, even though people are saying, oh, this isn't going to happen. Certainly, Cates' bill is worthwhile. Right. And the sanctuary city is also a no-brainer.
Representative Biggs, happy 4th of July, and thank you for spending time with us this morning.
Happy 4th.
Appreciate it.
Happy 4th.